Right.
Good evening, everyone. Thank you for joining us. This is the Region 6 Town Hall Forum. It's so quiet out there. My name is Mary Catherine Allen. I am one of the regional coordinators for the Office of EMS.
Hi, and my name is Greg Woods. I'm the other regional coordinator for the Office of EMS.
And so our positions are new. They were created and started in January when the regional councils moved from 11 to 7. And funny story is geographically, we are split up. Greg lives in far Southwest Virginia. I say far Southwest because there's a Southwest and then there's where Greg lives. And I am more centrally located. So our geographical differences helped us decide which regions. So Greg is region 1, 2, and 3, and I am 4, 5, 6, and 7. That does not mean that you cannot contact Greg or me if you're in another region. We actually talk daily and are together a lot. So we are working together on many of these projects that we're doing across the state. I'm winking at you, letting somebody know to advance my slides for me. Okay, so I guess the first thing we want to do is kind of introduce everybody that's here. So we've introduced ourselves, and Wayne.
Sure, I'm Wayne Perry. I'm the Deputy Director for EMS Operations.
I'm Lisa Baber. I'm the Vice President of the ODEMSA or Region 6 Board of Directors.
Alan Yee, the Regional Medical Director.
Hi, I'm Heidi Hooker. I'm the Executive Director for ODEMSA Region 6.
I'm Ryan Scarborough. I'm the Deputy Director for OEMS Region 6.
And I know there are, Steve, if you want to stand up, and you work for OEMS, so. Well, people that the ODEMSA staff. Is there anybody online from the Office of EMS?
So everybody online is muted unless they put in the chat that I need to unmute them.
Is there anybody that can raise their hand to let you know that they are from OEMS? Because I can't see.
Don't see anything in the chat or the Q&A.
All right.
Okay.
Awesome.
All right. Well,
But I'll let you know if we get an update.
okay.
All right.
I appreciate it.
So thank you guys for being here on behalf of the Office of EMS. We're excited to be here. We have been having town hall meetings all across the Commonwealth with the goal of providing information about some of the changes and important programs that are starting with OEMS, but also talking about the new regional structure and what is going on at the regional level. But the most important thing is talking about what your concerns are, what questions that you have. So we look forward to having really good discussion. It's part of building collaboration between our office, our regional offices, and all of the stakeholders. So this is our agenda for today. We're going to provide an overview of OEMS structure and some programs. We're going to talk about the regions and the transition through regional collaboration. And then we'll get into really the meat of this, which is hopefully you guys will be talking a lot and we will talk a whole lot less. And then hopefully that will lead to some discussions of where we go from here. So with that, Mary Catherine, I'll let you.
Okay. Next. Maybe. Okay. So we have already done the introduction of OEMS staff. Unless Ryan tells me otherwise, we're going to continue going. Next slide, please, will show our current structure of the Office of EMS. And so as you will see, it starts with OEMS Director, which is Dr. Bierman-Focht. She was unable to be here tonight, so she sends her apologies for that. And then we have the Deputy Director of EMS Operations, which is Wayne. He introduced himself a few minutes ago. And under Wayne, he has Emergency Ops Division, the Regional Council Structure and Coordinators, which is Greg and myself. And then the System Optimization Division, which includes EPI, Information Technology System Optimization Specialist. And then over here on this side, we have the Deputy Director for Professional
Standards
and accountability. I always miss the S. And right now the interim for that is Ron Passmore. And Ron is working under Ron is the trauma program, a regulation and compliance division, which is actually Ron as well. and OEMS reps, which Steve just introduced himself. He's underneath the Regulation and Compliance Division, and then Accreditation, Certification, and Education Division, which is known as ACE, which most of you are familiar with. And that is a division right now that we are steadily trying to build back up after we've had some staff leave. And then you have your business operations, and under that, we have procurement and EMS funding and the business analyst. And so that is what our structure is currently. Okay.
All right, so the work that we perform as the Office of EMS is mandated in the Code of Virginia, and also as within the Code of Virginia are specific requirements for regional EMS offices. So the specific sections actually call for the creation of regional EMS councils who are supposed to support the development of the unique regional EMS system, but we accomplish that through contracts with the Office of EMS that outline specific deliverables that align with the Code of Virginia, and specifically the state EMS plan requirements, which include 19 specific provisions that we as an office are required to deliver to be part of the EMS system. So our work with the regional councils is to extend capacity through contracts, and they are working on behalf of our office to accomplish some of those specific tasks outlined by code. Go ahead, Ryan.
Okay. Mike, if you want to take a second to introduce yourself.
Thank you. Apparently didn't have the ability to speak, which probably some people would enjoy. Michael Berg with the Office of EMS. I've been there for a long time. And with the Division of EMS Systems Funding, I'm the grants manager, oversee the Rescue Squad Assistance Fund, as well as the Return to Localities Fund, and also the interim director manager for the EMS for Children program for the Commonwealth.
Thank you. So the role of the EMS councils, I would not really say has changed over the years. What I would say is now that our system is a little different. And so it is no secret over the last 3 or 4 years that we had a financial shortage that caused us as a state to look at what we were doing and to do some restructuring. And part of that was there was a lot of people that came into that, the board of directors for the 11 councils at that time. We had engagement from other stakeholder groups, and they voted and came together, and then we have our new 7 regions. From that came to fruition in January. Prior to that, we had what was called an RFA application process that started last fall. And there were applications for those specific regions that were going to be the contractors. Out of that process, for your Region 6, ODEMSA was given that contract. And then there are other nonprofits that were given that, and they didn't have to be a nonprofit, but they ended up being nonprofits. So Region 1, do we have the next slide that shows the regions? That helps. Yes, thank you. So these are the new 7 regions. So Southwest down in Region 1, and then Region 2 is the Western Virginia EMS Council. Region 3 is what they call the manager, the Shenandoah Valley EMS programs. That is under Inverse. And then you have on Region 4 is going to be the actual Inverse. And then Region 5, under Inverse, they have what is called the Riviana Rappahannock EMS programs. And then Region 6, of course, is the Old Dominion EMS Alliance, and Region 7 is the Tidewater EMS Council. And these make up our 7 OEMS regions. So normally when you do the RFA application process, it is a 3-year contract when you sign. However, we were a little late getting started on this one. So January 1st started, and it's a 2.5-year contract, which will end June 30th of 2028. Gosh, that's hard to believe. Okay. And so again, in a little over a year, we will be starting this process again. And these entities will begin given the opportunity to apply as any other opportunity for other people that would like to apply, and it will start over again.
Regional councils have to be designated by the Code of Virginia. So the RFA was the designation process that we used for that. But then we did something a little different with these new contracts in that we engaged in a lot of stakeholdering and discussions with entities who had been designated. And so we presented a standard scope of service that is the same across all 7 regions. And then we allowed for each requesting agency to request special funding for special projects that were region specific. So Region 6 will talk about some of those programs that they are doing as special projects, but the core base standard contract is the same across all 7. We actually had some contract discussions and negotiations. So we met with all of those entities. We made some changes to the contract language based on reviews so that the contract that we currently have has been sort of vetted and shared and represents what we hope to be best practices for consistent delivery of regional EMS across Virginia.
And we suspect as the contract changes over the next, as we move forward with how things are working now, there may be differences to the contract next time. Just you learn as you do the new process. And so we'll see. Next. Okay, so we're going to let Wayne talk a little bit on the state EMS plan and what our part is in that.
Sure. That one also doesn't echo. There we go. So one of the responsibilities that I have is over the system optimization division, and we are tasking them with our new statewide EMS plan work. So up on the infographic here, at the top right, you'll notice that wheel that looks familiar from the EMS Agenda 2050. If you've not already had an opportunity to look at that, I encourage you to pull that down. It's available on the federal website, and it talks about what EMS could look like in the future and what categories and topics we should be thinking about as we move towards that future. So the purpose is to create enough information that we can make informed decisions to build a new strategic EMS plan. So we're going to have a 3-year EMS plan that will coincide with the VDH plan as well. And then the regions will also participate in this process. So the ask from this group is to get as many stakeholders involved in the information gathering process. So as we start sending out surveys, we start doing focus groups, we start sending out information, please help spread the word to anybody that you can. We want the most feedback that we can get so we can make good informed decisions. The timeline we started earlier this year in terms of building up the processes. So this will be done similar to the same process that the regional health districts do for their community health improvement and their CHA and CHIP plans. And hopefully our goal is to have by February of next year a draft to take to the EMS advisory board for their feedback, and then finally to approve in May, with the goal that it will be taken to the Board of Health for their final blessing and implementation in June of 2027. And I know Wade Richardson had asked one of the questions about this, so hopefully, is he here? Hopefully he's online to be able to get the answer to that question.
All right, so we do want to share information that we think is important for you guys to understand that relate to changes in how we're doing business. OEMS, right now, we're having lots of conversations focused on how we improve efficiency, how we meet the needs of the system better. And so one of the things that happened earlier this year, due in part to some of the staffing changes that have occurred at our office, was that we implemented an online education support ticket system. So if you go to the OEMS website and you click on the Division of Accreditation, Certification, and Education, you will find that form, prevalent right at the top of the page. And if you click on that, if you need support with a question about recertification, you have a question that relates to being an education coordinator, anything that relates to that division, you can fill out a support form and you submit that. So we know that people don't want to fill out support forms, and you think that we're not seeing that. And I want to clarify how that process works on our end. So everything that is submitted is stored and is actually sent to a team of individuals who have access to it to review all of the tickets that are in the queue. Those are assigned based on some of our unique staff experiences to individuals who, for example, I am supporting EC institutes and EC candidates right now. So most questions that relate to that will come to me. So we've broken those out among staff. But if I happen to be out of town for a specific week, or if I'm on vacation, Wayne can review those and he sees them and can reassign them to someone else. So what we're finding is that our turnaround for these are pretty quickly, most within a day, some within hours of submission, and our goal is under 72 hours to respond. So you actually receive back an email notification of where you are in the process. So upon that ticket being assigned to a staff person, you are notified of who is now handling that. Every time they make an update to it, it alerts you and lets you know where you are in the process. So it's a very in-depth system and is a very trackable system. And we're actually measuring and looking at responsiveness on a sort of a weekly basis to see how well we're doing covering those. In fact, that worked so well that our data system optimization division has created their own support form now as well. So you can find that on our website as well. So great opportunities to get, really fast feedback, trackable feedback with the issues that you may face in the field so that we can be more responsive to your needs.
We have had some people ask questions. So they want to upload something when they put in a ticket and they're not able to. When you get an email back about your ticket that it's been assigned to somebody, you can reply back to that email and put the uploads in. So that is a question that we've gotten at several of the town hall forums. So once you put the ticket in, you get the email back, you can reply and do your uploads, and that will allow, we've had that question from instructors that want to show something that they see on the page and they do a screenshot. You can then upload it so that we will see what you're supposed to see.
Yeah, we're unable to add that feature into the form because
Yeah.
of OIM restrictions, but you do have the ability to submit that. And we can have a communication. So I had a ticket earlier this week that I was back and forth with the individual who needed help probably 3 or 4 times in the span of an hour, really dialing into what the issue was so that we could resolve it.
So I know I like to talk to people, especially when I want an answer, but I promise you that this is the quickest way and that you actually get to see it being tracked and being worked on through the email system. So we really encourage you to use this process.
Right.
Okay, Virginia EMS Repository Workshop Series. So our system optimization group is working really hard, not only with the regional council staff and their PI, but wanting to reach out to EMS agencies as well. And so one of the things that we're trying now is we're doing 2 workshops in each region. And again, you don't have to attend the one in Region 6. You can attend any of these. But we're just trying to give multiple chances for agency leadership to attend. And as it says right here, it's giving you an introduction to the repository. It's giving you some utilization tools and features that it does, and it's just giving you an oversight of how the system works and things that will help you in your agency with some PI. And so we really encourage agency leaders to go to one of these workshops. You got 14 to choose from. So I would definitely choose one. I would share it within your agency, even if they are not the one that's doing data, just because I think it gives them an idea of what their agency is doing and how the data is, how it works. Our regional staff is working very heavily with Amanda Loretti, who is our system optimization specialist for the state. And so I think this is a great opportunity for the locals in the region and the state to work together. I do not see Chad on. Do you see Chad Mason on? No.
So
Okay.
we do want to mention, and I think, Heidi, are you all going to talk about this a little bit later? Okay.
Okay.
All right. So we want to make you aware that when there are emerging events or when there are things of concern, that OEMS is alerted to those. So as you know, or may know, there are some measles outbreaks in Virginia. And so our Division of Emergency Operations, that will soon be rebranded, has been working with Region 6 closely with VDH representatives and with Dr. Yee in preparing messaging and information to go out. So Region 6 has done a fantastic job at creating messaging, and they actually hosted a meeting for agency leadership so that you could be prepared. At the state level, we are tracking measles sort of across the state, and as it progresses into other regions, we look forward to probably meeting with those regions in the same way that we did with Region 6 to make sure that our providers are safe. So we encourage you to make sure your providers know about measles, that they're reviewing the resources that are available here in your region, and that they take all the precautions that are necessary to remain safe as well.
Thanks, Greg. I'm just going to add that on the ODEMSA website, we do have a lot of information on that. You can access it from the homepage. There is some training material information on measles and some direction for the providers. And also we had a regional meeting, and that recording is also there if you want to watch.
Next.
There's a slight delay between what's on here and what's there.
Gotcha.
No
Okay.
problem.
Wayne, do you want to do the rural health transformation?
Sure. So you may have already heard, but Virginia was successful in receiving Rural Health Transformation Program grant funding from the federal government. It's in the neighborhood of $990 million that'll be coming across 5 years for a variety of different projects. They have about 13 key implementation partners that they have been working with. VDH and Office of EMS is one of those. And what we've been asked to participate in is community paramedicine and mobile integrated healthcare type grants. So we're working with the Department of Medicaid Services. DMAS is the primary connection between CMS and Virginia. And hopefully we'll have more information maybe in the next month or two, but there will be some opportunity for funding targeting specific healthcare programs in the community paramedicine type of realm related to rural healthcare. I know there were some questions on here about rural healthcare, so.
Okay. I think this is your time. Sure.
Okay, never mind.
Well, thank you, both of you. So I'm Heidi Hooker. I'm the Regional EMS Council Director here for Region 6. I've been in EMS for 38 years. I've been with ODEMSA for 23. I began here as the Regional Training Director and became the Executive Director in 2008. I oversee the overall operations for the Board of Directors. If you see me around, feel free to ask me about the time that I played Hail to the Chief for one of our U.S. presidents. Okay. Next, Ryan, if you can hit that next slide for me. Next, we have Ryan Scarborough. He is the Region 6 Deputy Director. He has been in EMS for 23 years, with ODEMSA for 8. He is an education coordinator. He oversees the Region 6 special projects, which includes things like the awards program that we do, the drug box transition that we went through just recently, our whole blood program that's coming up. He handles the IT services here in the offices. And if you happen to run into Ryan, you can ask him about his time at Nickelodeon. Next, I introduce you to Heather Nelson. She's been in EMS for 13 years, ODEMSA for only 4 months. She's a critical care paramedic. She's an education coordinator, vast experience and volunteer career, urban, rural. She's a firefighter. She's a black belt in Taekwondo. And if you see Heather around, ask her about her haunted medical book collection that she's brought with her to our office, and we want to thank her for that. And next we have Chris Vernovi. Chris has been in EMS for 34 years, at ODEMSA for only 2 months. He is a paramedic and education coordinator, previously with the Office of EMS ACE Division and Chatter Divisions. And if you see him around, ask him about the time that he hung out with a country singer on their tour bus. You have to ask him who that was when you see him. And finally, we have Katina Downey. Katina's our accountant. She's been with us for 21 years. She's a U.S. Army veteran. She specializes in not-for-profit small business, bookkeeping, and if you see her, you can ask her about her cornhole lounge that she owns. Next, Ryan, please. So put this slide on here just to say that, you know, we do have two identities. You've obviously heard me say ODEMSA a few times, but we are also Region 6. I'm still getting used to learning when I should say one or the other. So you'll hear me use both of those. We're one and the same. The newly designated OEMS Region 6 is served by the Old Dominion EMS Alliance, or ODEMSA. So ODEMSA is the regional EMS council designated by the Board of Health to serve Region 6. So, and we'll go on to the next one. This next slide is a map of our region. Some people don't realize how large we are. Our region is 9,000 square miles. We have 7,000 EMS providers and 27 hospitals. Well, 28 now. And actually, there's more on the way. Each color that you see on this map is a Virginia planning district. And for us, it is separate sub-councils of ODEMSA. So in the red is our Southside sub-council. In the blue, and in the red, that's our Virginia Planning District 13. The blue is Virginia Planning District 14 and our South Central sub-council. In the yellow is our Planning District 15 and the Metro Richmond Subcouncil, and in green, Planning District 19 is the ODEMSA Crater Subcouncil. You can go to the next one, Ryan. So this slide shows you our organizational structure. As you can see, you know, and I've already said, and so did Mary Catherine and Greg, that we're under contract with the Virginia Department of Health, who and then we work through that. OEMS oversees that contract for them to us, and then we have our board of directors. And as you can see, each one of those sub-councils or planning districts has representation on the board of directors. The board of directors then directs the executive director, who oversees our staff and accounting services. The next slide just kind of breaks this down a little more. It shows you the officers of each sub-council, just for your information, and also the board of directors, executive officers. I just want to bring to your attention, and you'll see the stars on each one of the each of the sub-councils. Each sub-council has 3 members on the board of directors. So we find that this is a good way for us to interact with all of the area and all of the planning districts, all of our sub-councils. So we have a flow that goes from them to the board, back to the sub-councils. I invite those that are not involved with the sub-councils to be involved at that level. That's where we share information on plans and projects that we're doing, and give updates on anything that we're doing or that we know the Office of EMS is doing. And recently, Mary Catherine has been attending some of those sub-council meetings, so you can get information directly from her there when she's able to be there. And now I'd like to, next slide, please. I'd like to introduce you to Lisa Baber. Lisa is the Vice President for the ODEMSA Board of Directors. Lisa?
Thank you, Heidi. On behalf of the Board of Directors of Region 6, I would like to welcome all of you for being here, whether you're here in person or virtual. I have been active in one form or another with ODEMSA for about 30 years. If there's one thing I can say about this region's current and past staff, is that we share a true desire to work with and assist the agencies and providers of this region and the state in any way that we can. The board of directors and our sub-councils are made up of members from various agencies. We are providers in the EMS system ourselves, and because of that, We keep what is best for all of you all, the region, the state EMS system, and like I said, each one of you all at the forefront of every decision that we make. We're incredibly fortunate to have Heidi Hooker as our as our Region 6 Executive Director, Ryan Scarborough as our Deputy Director, along with Heather Nelson, Chris Vernaby, and Katina Downey. A harder working team would be very difficult to find anywhere. Their mission every single day is centered on one question: what can we do for the providers of this region? I think we've always worked closely with the State Office of EMS, but now we embrace the opportunity to work even closer with them. We're excited for the positive changes that we've already seen and will continue to see under the leadership of Dr. Bierman Fote and her staff. With their guidance and leadership, Region 6 will continue to be an organization that we hope our agencies and providers will always look to for unwavering support, trusted advocacy, and a shared commitment to saving lives. Thank you all for your dedication, your sacrifice, and your continued service to our communities. Thank you.
Okay, thank you, Lisa. This next slide shows to you some of the contractual services that we have in our contract with the Office of EMS and Department of Health. You know, they're pretty broad when you see them in the contract, but the next slide here kind of breaks down those services. So we have, through these that you're seeing here, we have MCI plans, a peer support team, EMS patient destination plans, STEMI plans, stroke plans, and so on. So the next slide that you'll see, I just want to tell you, everything that we do, or most things that we do, are done by committees. And these are our committees that we have that work on all of those plans, and the chairs of those. So between the board of directors and these committees, that's how we get most of the stuff done that we do here in the region. Next slide, please. Yes, now I'd like to introduce you to our regional medical director, Dr. Alan Yee, who is also now the state interim medical director for OEMS. Dr. Yee.
Thank you, Heidi. So, you know, as a medical director, I've been involved in the ODEMSA region and EMS for a while. I think I came to Virginia in 2000 and was impressed with the system. Very impressed with ODEMSA. We were actually, in terms of STEMI systems, we were actually one of the first in the country to develop a STEMI system. We took what we built with the STEMI system and we built the stroke system. Again, well ahead of all these statewide, you know, state regional, you know, committees that were developed. We had it in place for 15 years already. The men and women who run 911 calls in the region are incredible. This past year with Dr. Bierman Fote in place, I mean, she's got an interesting motto. When you dial 911 anywhere in Virginia, you're going to get excellent care. It may take you a little longer in some parts of the state, but we're going to give you the same level of care. I think that's what me as a medical director, that's what we strive to give you, the men and women out there in operations, you know, the tools that you need. So we've always in the past measured a lot of stuff, and we unfortunately didn't really take the next step and do anything about it. In the next, 24, 36 months, you're going to start seeing us make pushes to do these PDSA, process improvement cycles, to truly measure something, plan, do, study, act. So we're going to actually, use our data to drive this system. So exciting things ahead of us. I mean, EMS is rapidly changing in 2026. I mean, we have this rural health transformation program. We have larger healthcare changes. We have more emergency departments here in Metro Richmond and parts of Virginia than many communities. Mobile integrated healthcare is growing. Alternative destinations, telemedicine, all these things are just right at our fingertips, right to try. So I look forward to what we can do.
Thank you. And I'm going to ask Dr. Yee to continue, because the next slide is referencing some things that we've got coming up in the future, in the very near future. And in fact, some agencies have already started, but we'll let Dr. Yee tell you a little bit about our whole blood program.
So as part of the regional contract, the our special projects in Region 6 / ODEMSA was pre-hospital blood. Chesterfield and MedFlight already had a blood program, and we've already expanded it to Goochland, Hanover, Buckingham, and Dinwiddie are early adopters. So as a regional program, it actually goes live on July 1. We hope to shortly thereafter use the funds from the Office of EMS and expand it further to create a ring around Metro Richmond and the trauma centers. So if you're a trauma patient, you have to drive through the ring, and you can pick up blood. And that's in our first year. In the following year, we hope to expand it to get down to the southern portion of ODEMSA. So we should be able to get whole blood to a trauma patient, to a patient, any patient who needs it. You know, our goal is within the first 36 minutes of them calling 911, because that's when they show that there's significant benefit. At the same time, we put in for this grant, NHTSA, National Highway Safety Traffic Administration, put out a SS for a safe roads for safe streets for everyone grant opportunity. And Regions 1, 2, and 6 in collaboration put in for the grant for pre-hospital blood programs. So if the regions are awarded that, there'll be even more opportunity to have blood programs across the Commonwealth, and it'll accelerate our plan much, much faster. I believe we hope to learn whether we are awarded the grant in December. So we look forward. I think that was 1.6 million. I think we put in for something like that among the 3 regions. So I think this is going to be exciting times, but it'll be a lot of work with whole blood.
Thank you, Dr. Yee. So when we applied for redesignation, we did ask for some funding for a regional whole blood program, and we're very grateful to the Office of EMS for allowing us some funding to do that. That funding does not kick in until July 1. So, you know, we've not able to purchase anything quite yet, but we do have a lot of policies and plans and a lot of things ready to go. And we do have some agencies, like I said, that have purchased things prior to and are not needing that funding that we have. So in conclusion, for my part, I just want to say that our organization has been serving this area, Region 6, for nearly 50 years, and it is a great honor for us to do so. You know, the board of directors, myself, our staff, we really just want to try our best to help you be the best providers, be the best agencies that you can be, so we give the best patient care in the Commonwealth. Thank you.
Mary Catherine mentioned earlier the transition in structure of our regional system from an 11 region model to a 7 region model. And we did want to emphasize in doing that some of the core components and sort of our values that were associated with that. And one was commitment to regional representation was essential to that change. And so not only did we use that in the RFA process to assure that we had the right organizations representing those areas, but within the contract itself, we have built into it some deliverables that are related to ensuring the representation at the regional level and then representation at the state level. I will say this because I think it's worth being said that the model of your subcouncil system here in Region 6 has been talked about in other regions as an implementation model that they want to move to create greater representation and engagement within the other regions. So one of the opportunities that we have is to have conversations and to have representation between OEMS and regions. So we are meeting with leadership from all of the regions on a monthly basis. Individually, we meet with the directors and staffs of those of all of our regions at least monthly. And then every month we have a meeting where we bring together all of the leaders from all of the 7 regions from across the Commonwealth. So it's a fantastic opportunity to hear what the needs are in every corner of the Commonwealth. And then we serve as liaisons from the regions to our OEMS senior leadership team. And of course, our deputy director is here tonight as an indication of their commitment to working with the regions and supporting the development of EMS across the Commonwealth.
One of the core things we wanted to do was placing the town hall forums in the contract, and both at the region level and state level, we felt was really important. One, to build engagement among everybody and the agencies across the regions, but also transparency and to build trust, to be open and give you all opportunities to ask questions, but also so that you can meet us. And I think as these move forward in the future, you will find that these town hall forums will be more less about us speaking and more about you all and your region speaking and giving you information. We will be there more as updates or for any questions that you have. So thank you for your support of us. We are still at the Office of EMS because we care. We've had a huge amount of changes in the last 3 or 4 years. And if there are staff still working there, it's because we are there for a reason. We're not there because we get a great paycheck. We are there because we truly care about the EMS system, and we truly care about everybody that's in it, and we truly care about the patients that you're picking up and transporting. And so thank you for your support of us and for your patience, and thanks for your time.
Yeah, and I do want to add that you have a phenomenal advocacy team here
Yes.
from Region 6 who are advocating for not only the needs of your region, but the advancement of EMS across the Commonwealth. So thank you guys, your leadership team, for being here and presenting and sharing that information. So now we get to the most important and I think the most exciting part of our evening, opportunity for just group discussion. So we're going to open it up. We did post some simple questions in case you're afraid to talk or you weren't sure what to ask, but we don't have to answer these. We much prefer you to ask the questions that are near and dear to you so that we can answer them. Of course, all of us here will join in to assist with that, but the rest of our time together is for you. That's why we're here. And so you'll know my hometown where I live is Abingdon, Virginia, and it's in the far southwestern end. And so I'm actually closer to 4 other state capitals than I am Richmond. So it was a long trip to be here to meet you, to get to know you. And it's our pleasure to answer your questions and have great dialogue. In many of these town forums, it's really turned into discussions of how we can do things in the future together better. So we love those opportunities.
Well, since he said where he lives, I actually live in Nelson County, but for decades. I've worked in the Lynchburg area, which is technically really the Central Virginia area. Just putting that out there. If you want to be where centrally located, I'm just saying. So yeah, how did you want to move? Do you want to do the questions?
I'd like to know if anyone in the, first we'd like to know if anyone in the room has questions for us. When you registered to come tonight, we did allow folks to pre-submit questions if they wanted, so we do have those. But unless you guys have any questions, is in those online, if you want to raise your hand or put a question in the chat, you're welcome to do that.
We want to read from some of the questions that we got
Yeah.
during registration.
We'll go ahead and start by reading some of the questions that we got during registration. And if at any time you guys out here have a question, feel free just to yell it out, or for those of you online, just
Not yell it out to the podium and speak into the mic so they can hear you online.
Yeah, that's a great point. The folks online will not be able to hear you unless you come up and push the button to speak.
So our first question comes from Laurel Newton from Scottsville Task Force 17. What training events and activities are open for participation by individuals across the districts?
So I'll answer that for here. We're on our website, we're building a central hub to list all of the training events. But in the meantime, until we have perfected that, We do have on our website, under training on the ODEMSA website, go to training and then click on regional EMS courses. And then from there, you'll see an OEMS course search. So that'll allow you to search for any courses that are being done by region. Once you find something that interests you, you can click on that and there is information on how to contact the instructor for more information.
I would like to say something just so everybody is clear. Region 6 does have access to provider email addresses and super users, but please understand that that information is only as good as you keep it updated. So if you really want to stay updated, you need to make sure that the portal, the email address that you have in the portal is the most up to date. If you are a provider and you are not receiving emails from your agency leadership or the super user of your agency, you need to go find out who that is and make sure that their email is up to date in the portal. Because if regions are sending out information to those people and they don't have that updated, you're not going to get information. So we just ask that you all really take the opportunity to do that and make sure that you have the most updated information.
Okay.
Yeah, I will add that the Office of EMS website does have a capability for an EMS course search as well. So that is based on the course approvals that have been submitted to our office. So all of the courses that are available are listed there. It typically will have some contact information, so we don't necessarily have control of those courses beyond the approval process. So if you have questions of meeting times and so forth, it's a good place to look for information, but we're also sending out information about courses all across Virginia. And most of these, there may be a few that are within a specific agency, but almost everything is open for anyone from across the Commonwealth. So we share that to our regions. All of our regions are working on communications, and so developing listservs. I know ODEMSA Region 6 has listservs that they're using that are very effective. And so any of those courses that you see, we encourage you to take advantage of the educational opportunities that are all across Virginia.
And not that we're trying to hone in on any of this, but while we're talking about communications, obviously our webpage has not been updated for a long time. And so we've taken an active role in trying to update our webpage. And EMS Ops Division under Chad Mason and with Sam Burnett have done a really phenomenal job in trying to get it updated. It is not his job to do it, and he wasn't even voluntold. He actually volunteered to do it. And so he is doing it along with his other job and is doing a great job. If you go and find a page on the website that is really outdated, please make sure that you send that information to Heidi or to Greg and I so that we can let him know. There have been some pages that they have gone and put down because the information is so outdated and they're working hard. So we do ask for your patience. There is a spot on the website now. I think it's called EMS Council or EMS Region. But it gives you the whole map of the regions, and you can actually go in and search by locality and put your locality. It'll tell you what region you're in. It'll tell you who your regional coordinator is, and it'll give you the contact for your regional office if you need to contact that as well. So there's a lot of good things coming as far as that is. Oh, and your program rep too. We were talking about that. I didn't know if you'd actually done that. So it'll actually give you your OEMS program rep information as well. So thank you.
So this is my first time using Teams for such a large group event. I was not aware that there was not a chat option turned on, but there is Q&A turned on. So if they have a question, they can still put it in the Q&A section, which should be available now. Our second question comes from which one? Number 2? Okay. Uh-oh, hold on. We lost TVs. All right, number 3 is member from Tuckahoe. When is the next ALS coordinator update?
All right, so we do have an educator update scheduled for July 26th. That will be at Central Virginia Community College. And then we currently have an educator update scheduled for September 25th, 2026, here at the ODEMSA office facility as well. So there are two. There are other sessions that are going to be added, but those are the two that are upcoming. And this serves not only ALS coordinators, but education coordinators as well can attend that update and get credit for recertification for those credentials at either of those. Those do not require you to be living or working in the specific region where they're held. So we encourage you to if one of those meets your schedule, to use those. Those are listed on the OEMS website. So we're updating those, and I was checking the website just to make sure that we're getting those. Some of those were just added this week, and so we're getting all of those dates on there. But we look forward to updating that list as need is required across the Commonwealth, and we are committed to supporting educators and making sure that there are adequate opportunities for the training that you need to maintain your knowledge and to maintain those credentials.
Next question is from, it's actually a multi-part question from Gail Weatherford with Forest View. And there's related questions. What support is available for training in general EMT classes across the region, especially for volunteers? And are there plans to offer classes?
So regionally, some support that we have an equipment loaner library where we can loan instructors a vast array of equipment and resources for your classes. Now, many years ago, the board of directors put in for a grant for our region, and we were able to successfully get equipment, which was then placed in each of our 4 planning districts. So no education coordinator or instructor has to come here to the ODEMSA office to get equipment. They can get it within their planning district that they're in. Now, I'm not saying they'll have everything there, of course. We may have some things here at the office that are not available there, but there are some resources there for you. The ODEMSA staff, we only are 4 now, but three of us, not me, are education coordinators, and we're always willing to, if you need help, we're always willing to pitch in and help with some stuff. Are there plans to offer classes? Yes, upon request, we can do that. We as the region have not in many years done a class. We've been without a training director for over 2 years. And we just hired Mr. Vernevi on 2 months ago. And in the 2 months that he's been here, he spent 2 weeks with prior commitments teaching some stuff in other parts of the state. So we're just kind of kicking back up our training resources and the training programs that we do. So I think that if you will give us a little more time, you'll see some very interesting things come up in that realm. She also asked how new instructors will be trained.
All right, I'm happy to answer that, and then Wayne, if you have anything to add. So to become an instructor in Virginia, there is a process. It's a 3-phase process that is completed. One is making application to be an education coordinator. So that is the application phase. It requires submitting some documentation and paperwork, and it is an application process. Also included is getting permission from someone who will serve as your mentor and from an operational medical director to provide oversight. Once that is completed, you enter what we refer to as our candidate phase. And within that phase, there is a requirement that you teach with an experienced instructor and learn about the curriculum, learn about instruction, and they mentor you in that process. The number of hours that you teach varies based on your level of education and experience, and so it can vary a little bit. And then once you make it through those hours, and you take the National Registry cognitive exam. So there is an exam piece as well to move to complete the candidacy period. There is an education coordinator institute that is held. There are multiple sessions that are held. We had suspended that for a little while because of some of the changes that were going on within the office. But just last week, we held an education coordinator institute. Chris Vernevi, one of those other commitments, was actually there assisting with that. And so we have two more scheduled, one in July and one in September as well. So beyond that, we're uncertain exactly what the scheduling will look like, but does require completion of all three of those elements. And of course, at the same time, there are some discussions at the state level about education, educator credentialing, and some committees are looking at potential future models. As I mentioned earlier, OEMS is at this season in our existence really looking at how we do everything and the programs and the policies and how we serve to make sure that it is the most up to date and the best for providers and agencies across the Commonwealth. And so we're not afraid to have conversations about is this the best model? So I think there are some discussions that are happening in the committee level with the EMS Advisory Board where they're talking about that. So there could be, changes in the future, but for the moment, that process begins. You can make application within your EMS provider portal, and we do have information on our website that talks about each of the phases that are required for education coordinator candidacy and then ultimately completing that process.
Gail also asks, how does the Office of EMS plan to support agencies and providers in the future, especially with limited staff?
So I can take that one. So one of the things we're going to do is get feedback on what the needs are in the region. That's part of why the town halls were put into the contracts. That's part of what we're asking the regions to help identify, because the needs here in Region 6 may not be the same as in the other regions. So we're relying on those entities that are our contract agents to help bring that information to us, to participate in the needs and fulfilling some of those needs that they're able to do at their level as well. We do have a new prospect that we're doing, which is the special funding. I think Heidi mentioned that earlier. So at the start of each of these RFA processes, there's a pot of money that's available for the regions to put in a special funding request, something that's a need for their region that may not be the same across the whole Commonwealth. So that's one opportunity that's available. As far as the OEMS itself, one of the things that we're looking at, as Greg mentioned, is reevaluating all the processes and figuring out, are they working well? Are they working the best that they can? What resources are needed to do it that way? How can we leverage technology or automation or collaboration with other entities? So we're reevaluating all of the things that are happening to see if we have ways that we can improve some of those processes. One of those that I mentioned earlier was that ticketing system. So being able to more quickly respond and have more people with less single points of failure on getting responses back to inquiries of our office. So that's one piece. I've also tasked the Emergency Operations Division with doing an inventory of all the equipment that's available. So we have some resources such as sim ambulances, sim trailers, sim equipment, things like that. And we have some emergency equipment like generators and other components that we would like to pre-stage in some of the regions or create some sort of a process where it rotates around through the different regions. So maybe Region 6 has the pediatric trauma simulation trailer this month or this quarter, and then it goes to Region 7 next or something like that. So those are some of the things that we're working on to support the EMS community at the state level.
And I think last, Gail Weatherford submitted these questions, and I know her well. Gail is an educator. In fact, she won our Educator of the Year award, Regional EMS Award several years ago. And Gail, I invite you and anyone else that would like, Region 6 has a training and education committee. And if you have an interest in these things, we invite you to come to those committee meetings. They're posted on our website. You can see the dates are on there. We invite you to join us in that. And you can bring up concerns there that need to be discussed. And then maybe solutions to some things that we might need to tackle. can be discussed there. But we welcome you to join us there, Gail. Thank you.
Connie Moore has a question. I'm going to try to get her online. If you can try to unmute Connie.
Can you hear me now?
Yep, we can hear you.
Okay, sweet. So since rural EMS is an issue and a concern in lots of conversations that have been mentioned today, especially with the telemedicine and the paramedic program and everything coming on, how can rural EMS continue to survive when we're training new providers through our struggling EMT classes and only to have them get certified and leave and go to the greener pastures in the metro departments? The retention issue in rural Virginia is becoming overwhelming in so many ways, whether it's volunteers or career staff, because every time we train someone, they go to another place to do the job that they've been trained to do and have no interest in staying at the local entity that provided them the training to start with. Does OEMS still have a recruitment and retention program? Is it still viable? And if so, where is it?
So I'll take a little bit of this. Part of the Rural Health Transformation Program, not through the Office of EMS, it's through another department. There's some initiatives to increase healthcare providers in the rural communities, and that does include EMS providers. I mean, some of the solutions for this is, and this is my personal opinion, I'm not speaking as a regional medical director, the medical director, Chesterfield Fire and EMS, or the interim state medical director, but my personal opinion is if we actually make EMS an essential function, essential service, then the localities should fund these services appropriately, and which means paying an appropriate wage for retention. So that's part of it, and dedicating the resource you need to deliver EMS in your community. So, but this is not an uncommon problem across the United States, where smaller communities lack the resources. So this is a huge problem that everyone's facing across the country.
We just had the Region 1 town hall the other night, and there was some interesting conversations because they border other states. So they have some individuals that are trained that may go across state lines and work in other agencies and departments. And obviously retention and recruitment was one of their big topics. Dr. Bierman-Folk relayed that in her travels, there are agencies in Virginia that are in similar setups and circumstances and don't have those recruitment and retention problems. So the kind of question back from that conversation was, what are they doing differently in order to be able to solve that problem versus how other agencies are doing it? Is there an opportunity? Is there a need for some other mechanism, some other view of this, whether it's, from the leadership perspective? It's not always tied to money. It could be just sort of what the individual is getting out of those programs. So as an example, you can, in now current times, you can kind of stay home in your basement and make money on your phone doing things. And what are they getting out of that they aren't getting somewhere else? And how can we take what they enjoy from that and apply it to our profession? So it's definitely something that, we're interested in. As far as an actual recruitment and retention program from the Office of EMS, that is not a current program that's offered. We've whittled down the staff and the programs and services to the bare minimum required by the code. So we don't have any active, recruitment and retention programs, although it is part of the contracts for the regions to address that topic.
Wayne, thank you for bringing up the discussion from Region 1. One of the initiatives that they're working with, they actually partnered with another nonprofit, and it is focused on building capacity in lots of workforce areas. The uniqueness of that, they actually requested some special funding through their contract process to support that. And this entity actually brings in, I believe they said around 70,000 middle and high schoolers a year to what they call their career commons. And within the career commons, there are employers and setups there from lots of industries. But being added to that in that particular region is EMS. So they have built a mobile simulator that can be moved around the building, but moved into the hall as well. So it is a mobile EMS, and they're working with providers to staff on those days when they have groups of students. It actually exceeds the footprint of Region 1. It actually bleeds into, they have some service overlap with Region 2 from that nonprofit. So they're trying to engage with middle and high school students early, and they're also in discussions with that same entity that they're going to look at a model for EMT training for high school that is different from other models that I'm familiar with. And I've been familiar with many across the Commonwealth, but it's sort of a unique model. They're doing it now with a couple of other programs there. So there's some exciting opportunities. I think that shows the value of being in communities and having conversations with other players. There is a healthcare workforce group that is working within that region. So I would encourage us to look at, where are other health education and workforce development work groups across the state and to engage with them. But I'll use all of that to say that the benefit of our new structure and the conversations that we have, our interaction with Region 6 is really intended to be bidirectional. So it's not that we're giving information and we're passing it down. It's not that they're telling us things, but that we have conversations. And one of those opportunities is to identify, as Wayne said, programs that are doing really well and models that are working in other areas. And so I mentioned earlier that learning from Region 6, one of our other regions, is looking at their governance structural model, and the same thing can happen. So I think it's a great opportunity for our regions to have conversations to say, this is something that we're struggling with. How can we address that? And that may be bringing in folks like you, Connie, who have interest in a program, and individuals who have had success in one way or the other, and developing models, from the expertise and the experiences of others that may be able to work in other areas. So I don't think we don't have a magic bullet for that. We don't have the capability to answer it. But what I know is that EMS is blessed with really intelligent, dedicated, and innovative providers that together, I believe we have the expertise to find solutions that will work. And our new structure with 7 regions and our integration with OEMS really provides a better forum for us to be able to address issues like that. So thank you for bringing that up.
All right, Connie, I'm gonna go ahead and mute you if you haven't already muted yourself. There we go.
Anybody in the room have any questions? Come on up.
So I have a question for myself, and then as well as somebody who's online who asked if I could ask something for them. So the question for myself as an EC, are you all still actively looking to replace the role prior of the person who had left the role? We know that you guys have not found a candidate that fits that role yet. Just wondering if you were still actively looking for them. And then my second question to you with the EC Institute, is the Moodle, the test for updating, going to still be the same? Because prior to, the individual who was in the role at the Office of EMS was in the process of working toward that being updated, because it's very outdated for us to update as ECs. A lot of the questions don't make sense because some of the individuals don't work throughout the Commonwealth anymore.
So thank you. Those are great questions. I will try to answer as much as I can, and thank goodness our deputy director is here as well. So we are short some staff in the division of accreditation, certification, and education. So there are HR processes for positions that have been vacated that we're working through. So I can't give an update on where we are, except to say that positions were advertised, and there's HR processes for both of those. In terms of your question about the EC update and Moodle, I'm making a note of that. In one of my new roles, I'm supporting the EC Institute and candidate process, and so that's a great question. I don't know where we are, if it got updated, but I do also want to say that at the EC Institute that was held just last week, that both former members of that division staff for OEMS were participating and assisting, and we still maintain positive relationships with them. The future of the EC Institutes going forward, we've had some discussions of what that will look like, and maybe how that is going to be conducted in the future. So that could change, and so I'll make a note of that to see where we are, and to try to push that forward and update if we haven't completed it.
Thank you. And then the question online, this is from Melody Spivey, Lieutenant Melody Spivey at Charles City. She says, is there any forecast to return to state certification testing away from NREMT?
Unless you want to speak to it, since, okay. No. The process of developing a psychomotor or any kind of a validated test at the state level is millions and millions and millions of dollars, and then has to be redone periodically. So it's a manpower intensive and a cost prohibitive process, which is part of why we got out of the sort of the written testing process when EMTI was sort of the last remaining piece of that. So there's no current plans to go kind of back into the state model and away from the national model.
And I also want to add that we are also part of the EMS Compact. And my understanding is part of the Compact entry level certification. Your initial certification is through registry. So once you get it, and you could take your license in Virginia, certification in Virginia, you could work in I don't know, West Virginia or Massachusetts if they're registry states. So there's a huge advantage of registry for us, and vice versa. Somebody from Colorado with a paramedic license can come into Virginia. The minute he steps foot in Virginia, we recognize his Colorado paramedic certification or licensure, and he could work day one and just got to do the paperwork in Virginia.
Okay, I'm making sure there wasn't anything else. We do have an online question from an anonymous user. It says that ODEMSAprotocols.com is ranked higher in the main ODEMSA website than the main ODEMSA website in search engine, and the content on that website is out of date. Can we get that website either updated or taken down, please? So this was recently brought to our attention. We've done some research and we're working to see if we can get that website taken down, or at least have them redirect to our app or website. That is not something that we have any control over. And that's all I have, unless Heidi has anything to add. We also have we have a question from Clinton Brame from Brunswick.
Can I add one thing on the
Yeah,
website?
go ahead.
That made me think of one of the topics that we have encountered. We're finding some people that are submitting a ticket and they'll have this website page. It's not currently active. It's nothing that we have turned on, but it was cached on their local device. And in order to increase the speed of operations of their computer, it saved that information from 15 years ago. So that may be one thing, Ryan, just to remind people periodically to make sure they're actually traveling to the website and getting the actual current information versus using a version that was stored locally on their device.
All right. Thank you, sir. So I'll go back to Clinton's question from Brunswick EMS. He says, what are we doing to raise standards in rural EMS, given that just getting the call answered isn't enough anymore, and that Virginia's EMS systems are 30 years behind our neighbors?
I feel like this is a loaded question. And so we are a commonwealth. So we are not like many states. Take North Carolina, for instance. So in a Commonwealth, the localities have way more control over the state, where in North Carolina, the state says this is what you're going to do and you do it. And so when you're in a Commonwealth, that's why I personally, not as an Office of EMS person, have always said in the Commonwealth, it's very important that you pay attention to who you elect as your Board of Supervisors, because they really control your day to day. I'm not saying that your state and your federal is not as important, but if you really want to get down to what's controlling your day to day and who's controlling the services that are coming to your door, it is your local officials. And so to raise standards in Virginia, you really have to start at your local level. You have to be an advocate, not only for your agency, but you're being an advocate for your patient. And so that's why agencies really need to work on their PI and their data, and to make sure that when they go and speak to their local government, they can say, listen, it took us 25 minutes to get to this call because we don't have a second truck at peak hours, and these are our peak hours because our data shows that these are our peak hours. It's important to talk to your regional council, because your regional council can pull regional data and show you where this is from Brunswick County, where Brunswick County lies regionally as their data is. And then you can also get data if you fill out the ticket for the optimization, system optimization, they can pull data at where it is the state, so that you can go and talk to your local officials and say, this is where we are ranked and what we are doing and what we are providing. And this is what we need from you to be able to provide the best patient care to our patients. That's why the rural health transformation is going to be a great project for these rural localities to figure out how to get the call volume down, how to help readmission rates, but at the same time being able to answer those calls. I see Dr. Yi going for it.
So what, I'm not sure if folks know, but at the Office of EMS website, the data pages, you can add, there's multiple dashboards, I think you call it. And you can take the dashboards and drill it down to the whole state, ODEMSA, and Brunswick County. So you can actually compare Brunswick County. You got to run it twice to compare it to Cumberland County. But again, this comes down to one of the initiatives that we have in medical direction and PI is measuring something just to measure it is useless, right? You got to measure something and then improve upon it, right? Otherwise, it's just futility without the improvement part. And we're going to make a lot of efforts over the next, in the near future to do truly process improvement with the plan, do, study, act cycles. So I think that all of us in Virginia are all at the same stage that we want to actually start using the data to improve the system. So I think you'll see change over the next couple of years.
And I'll add that, if anyone feels that we are 30 years behind in any area, Region 6 has a medical direction committee. This committee is chaired by Dr. Alan Yi, and it is comprised of all of the operational medical directors of each agency in our region. And these OMDs come together at this meeting quarterly, and anybody is welcome to bring forth concerns to that committee so that they can discuss it. And if it's something that we feel like, or that you feel like they should do, they'll have a discussion. And it could be that you can make some change if you bring it to their attention and they feel like it is something that the region should be doing. So we invite you to participate with us and to get involved. Thank you.
If I may interject as well, and Steve is here, so I don't want to speak for him, but every agency is required by regulation to have a performance improvement process. So when I hear standards, I think about how well we're providing care, but standards could really be lots of other things. But standards in this sense, PI is a great process to make sure that we're providing the level of care, and there is also an onus on medical directors to ensure that that process is happening. And so there is great advocacy at the state level for this. We talked about the PI workshops that we're having and the regional network of PI personnel who are going to be moving this forward. And our Division of System Optimization is, highly aware of this. I also wanted to point out, though, that this is a great opportunity to reinforce the importance of our EMS needs assessment, because it is a state-driven, statewide process, but it will be comprised of information that is provided locally and regionally. And so helping us understand what those needs are, helping us understand where those deficiencies are, is the only way that we can ever move the needle. So we have to define those standards first and have a clear understanding of where we're going in order to measure them, and for our measurement to mean something and to know that we're moving forward through that process. So, I would love to have a conversation about all things rural, because it is a passion of mine based on where I'm located in the state particularly. But, we can have lots of conversations of the challenges that relate to rural EMS. But we talk about things like recruitment and retention, and there's not a lot of data out there, even nationally, that is really drilling down to why we're losing people. And if we don't understand why we lose people in a real and tangible way, then we really can't create programs that will fix that. So that our needs assessment process will give us an opportunity to better understand those needs and those issues. And I'm begging you to please engage in that process. Make sure that that you're participating, that you encourage your colleagues to participate. Help us spread the word about it, so that what we get back and what we create that is setting sort of a vision for the future is a vision that is measurable, and that we can mark our progress, but that is also filling gaps and needs all across the Commonwealth in all of these areas.
So I do appreciate the gentleman asking the question from Brunswick, and I
Yes.
hope that they take when we send the needs survey out to the region and the region sends it out, please take the time to fill it out and really put your thoughts down and suggestions so that we can take that.
I was going to plug the statewide EMS plan, but you already did that. But I'll plug the EMS advisory board and their committees as well. So Region 6 has a representative that sits on the EMS advisory board that is a large multi-stakeholder consortium of ideas and information. So they would love help on all these committees and these work groups on these projects, setting these standards and evaluating the current standards. So I encourage you to reach out to Region 6 and get involved in their regional committees, but also the statewide committees. We're always looking for more people.
All right, we have a online question from Chris Kraft. You want to try to unmute, sir? There you go. It looks like you're unmuted if you want to try to talk.
Ryan, can you hear me okay?
Yep, we can hear you now.
Okay. Hey, just wanted to say thank y'all for doing this. I think this is a long time coming. We have lacked in communication over the years. And in addition to serving as vice president for the Southside EMS Council in Region 6, I'm also the state training officer for the Virginia Association of First Responders. And I've heard several people talk about training and training opportunities. We just finished up our rescue symposium in Blacksburg this past Sunday, and we had 130 classes over 10 days. We had almost 500 people in attendance over those 10 days. And one of the classes that was offered was actually a paramedic research program that was put together by VCU paramedic program and done by their instructors. The rescue symposium is going to be every year in June in Blacksburg, but we're also going to have 3 mini symposiums that are going to rotate around the state each year. And those are going to be 3.5 to 4 day events. I've also instructed all my instructors in this past week that whenever they do a class, they need to contact their region and let them know so they can help promote that class, so we can help promote the training. And again, I just want to say thank you all for doing this tonight. And I'm going to put a plug in. Dr. Yee, knocking on wood, will be with us in Harrisonburg in October doing BLS and ALS skill day. And with the rotating ones, we're going to be reaching out and trying to get each region's OMDs involved to come out and help do that said training.
Yeah, I just want to say thank you for speaking and for reminding everyone here that of your organization and all the training that you do. Yes, absolutely. Take advantage of those training opportunities. And then I will offer, if you will send those training opportunities to Mary Catherine and myself, we're sending out, I say we, it's Mary Catherine is sending out on a weekly basis information about training that is going on all across the Commonwealth to our regions, and they're pushing that out so we can help reinforce your schedule and your opportunities so that we can help get the word out as well. So, we're happy to do that. So our contact information will be at on the last slide, I think. But you can reach out to us. I know Kevin Dillard has our contact information as well and can share that with you. And then
Okay.
I wasn't sure, do you all still have recruitment and retention training as well?
We
something-
do.
Okay.
It just hasn't been offered in a while because we haven't had a request for it.
Okay. So that may be an opportunity, and I'm glad that you spoke so that we could be reminded that you do offer programs like that as well. So there are some other training capabilities and programs out there that would assist with the earlier call that we had asking about specifically recruitment and
Right.
retention. So thank you.
And for this year, one of our training classes is going to be in Harrisonburg. That's going to be our convention in October. Kevin Dillard has scheduled a mini symposium in December at the Kalahari in Spotsylvania. We're going to try to have some discussion with him on that and see if we can move that next year to November. And we try to do it 3 to 4 days of the original EMS symposium, which was done by OEMS. So we can try to get it in before the holidays and people start getting busy with their families. But again, if you're a member of the association, all of our classes, you can get CE in. And for you, sir, up in Abington, our Swift Water team, they actually got deployed to Dante back in July and had 4 successful rescues. Those instructors are going to be doing 4 Swift Water rescue classes between you and Grundy through the rest of the year. If you would like to promote that.
Yes, thank you.
And I will try to get your email. And actually, I know it's a lot because I've talked to Chris about it. But anytime y'all want to look at the training, just go to the vafr.org website and just look at the training calendar because it covers the entire state. We don't break it down by our districts. Anybody have any questions?
No, thank you so much.
Thank you.
Thank you, Eddie. We have a multi-part question from Winnie Dunn with Ashland Volunteer Rescue Squad and Randolph-Macon EMS. Are there any changes to initial programs, request and announcement process, paperwork, or other portions of these programs? Do we want to break it out into separate parts or just continue down?
I can take that one and I'll do the rest of them too.
All right.
So currently we're using the existing process for course approvals and applications through the EMS portal. As I mentioned earlier, we're evaluating all the processes and all the different things that we have in place and figuring out the best way to leverage the tools and the resources that are available for this. So there could be changes, but nothing has been changed at this point. For continuing education, is there any change to how hours are requested? And will that be handled through ODEMSA or continue through OEMS? So currently the process is to announce courses, both initial and continuing ed through the Office of EMS. And then I don't know, Heidi, if you have any specifics about regional training you want to add to that?
No.
Okay. And then the last part, does the OEMS Education and Certification Division still exist? If so, who is the contact now? And if not, who can ECs call for assistance? So I think that's a combination of the former Division of Education Development and the current Accreditation Certification Education Division. It does still exist, and the best way to contact us is through the ticket on the website. If you go to the OEMS website, probably on the DEMSA website as well, you can link to it, fill out a support ticket, ask your question, and then depending on the type of question and who's available, it'll get routed through that way. And who can ECs call for assistance? You can call your regions, and Heidi can help you get contact with the resources that may help you, or she can also point you towards us if that's a need be.
He asked if I had anything to add. I'll just say, you know, we do have now a regional training director, Chris Vernevi, so you're welcome to reach out to Chris for any needs you may have.
Oh, thanks. All right, next question is from Daniel. I'm going to butcher this last name. I'm sorry in advance. Daniel
Krutler.
Krutler. He's with the NAEMT and Emergency Services Solutions. Are there any state EMS advocacy initiatives and events for Region 6, for the Region 6 area that NAEMT advocacy could help support?
I'm not aware of any specific Region 6 events, but workforce development and EMS funding remain ongoing priorities where NAEMT advocacy can be helpful. Does any of y'all want to add anything?
All right, another multi-part question. This one's from Sandra Bailey. She's with Hanover High School's EMT program. What is the current, and if I missed something that we've already covered, just let me know. What is the current Virginia Office of EMS structure and which roles remain empty?
So we did provide the organizational chart. As we mentioned, we have some vacancies within our division of accreditation, certification, and education. But from the structure that we shared earlier, other than those positions, I think we have everything else now filled. I will say it is a smaller structure than it was a couple of years ago, and it is subject to change. We know that we have some folks potentially looking toward retirement at some point in their career. So but right now we know of those education positions are the only ones that are in an HR process for us.
All right. What challenges does VA OEMS District 6 face in coordinating with OEMS and providers? I guess that's you.
Yeah, our coordination with the Office of EMS has much improved with this last contract, which, by the way, is the best contract that we've ever had since I've been with this organization for 23 years. It's a great partnership. We're meeting with them twice a month at least, and then a lot of conversations in between. Regarding challenges with the agencies and providers in the region, I would say that we find it hard sometimes to reach the boots on the ground to, actually communicate with the provider on the street. And it's something that we try hard to do. We hope that our app would help with that. And it did. But I will say that just recently, the Office of EMS has given us access to the provider emails. So for the first time, we did use that tool that we've been given. And for this town hall, we actually sent the invites to every provider in the region. So every provider, all 7,000, received the personal invite from us and the registration information. So that is a good step forward for us in achieving these things.
How should
I'll take
You got
that.
something else?
Yeah, Sandy has also, how should EMS providers and educators reach out with questions on various topics? Sandy, like I said, we've just brought on Chris Vernovi. He's our regional training director. Reach out to him if you need anything. I'm sure he'll be very helpful to you. And also, you can, we invite you, Sandra, to join our training and education committee if you would like. That, again, they meet quarterly. And then last, she says, are there any ODEMSA protocol updates? Yes, there will be some coming soon. And I think this is something that I should address with those interested. We were in the middle of updating our protocols. We're going pretty strong with that. Again, staff updating the protocols in conjunction and with the medical direction committee. Unfortunately, with some of the chaos that happened at, on the state level and also regionally, there was a period of time when we really honestly didn't know if the regional councils were even going to exist. We lost some good staff. So at one point there were 2 of us in the office working. So that was unfortunately one of the things that had to be put on the back burner with some other priorities. But now that we have Chris on board with us, he is our staff member that coordinates with the medical direction committee, and it's his job to get those protocols updated as soon as possible. So upon his hire, we did tell him that was a priority that we need done as soon as possible.
Sure nobody else has anything to add. All right, from Deanna Lester with Alberta Fire Department. She has several related questions on rural EMS equity in Southside Virginia, because we need to establish which Southside Virginia. But the first question is, are there plans to expand support for community paramedicine or other innovative rural healthcare models that can help bridge gaps in access to care?
I think that's going to be rolled into the Rural Health Transformation Program that agencies likely will have an opportunity to apply for funding to create such programs. And this way we can compare program A from one area to program B from another area and really look at outcomes. So I think this is an incredible opportunity coming in the next couple of years. Next question is, how is Region 6 measuring and addressing differences in EMS access and healthcare outcomes between Richmond urban area and the rural southern localities? We actually measure that relatively well now. Well, like I spoke before, is what we don't do well is make changes from the measuring. We just keep on measuring. And obviously nothing changes because we didn't change anything. But now with Chris and Heather on board, we can actually update the protocols, make changes, have them go out do the education or assist programs, assist agencies in educating, and then we can really truly do a PDSA cycle. So I think you'll see a lot of changes and improvements.
Part of that upcoming training on the 30th and throughout the region also ties into that as well. All right, next question is, what specific initiatives are being developed to support volunteer and combination agencies in Southside Virginia with recruitment and retention? I think we answered that with Connie's question. Given Virginia's focus on maternal health outcomes, what roles does OEMS see for EMS agencies in supporting maternal health in rural communities where obstetric resources may be limited?
So there's a distinct portion of the Rural Health Transformation Program funding that goes towards maternal health. That portion is being managed by the Office of Family Health Services through the Virginia Department of Health. So as the community paramedicine side and the maternal side are being developed, we're looking at crossover points and ways that we can work together on different programs. But there is an opportunity for funding on all kinds of different areas, whether it's technology or maternal health through the RHTP.
All right, next question is, how is Region 6 ensuring that regional planning, funding, priorities, and performance measures adequately reflect the unique needs of rural EMS systems?
So Region 6 does an annual agency. We call it our annual agency update. But the purpose of that update is for us to gather information from the agencies so that we know who to contact for things like your training, your leadership, your infection, your DICO information and such. But also within that is a needs assessment that where we will ask questions. Beyond that, we do planning in all the planning districts. As I told you when I gave my presentation, all of our committees in Region 6 have representatives from each of the planning districts or sub-councils. So, that's another way to feed information in and to let us know your needs.
All right, next question is, how many Region 6 leadership meetings, educational events, and outreach activities have been held in Southside localities compared to the Richmond metro area over the past 3 years?
It's a funny question. So in we have not done a lot in the past 3 years. We've been in a situation where we didn't know if we were going to have funding. Like I told you just a little while ago, we lost providers and how many have we done in Richmond compared to the other planning districts? We've done no training in Richmond or the other planning districts. It's been zero. The only thing going on right now is we did have a EMT instructor ask if he could teach an EMT class here in our office, but that's really not anything that the organization is really doing. We just haven't had the bandwidth or the manpower to be able to do that. But I do think that in the coming months that you'll see a schedule of training events, and like normal, like before this, this period that we just ended, we do training in all of the planning districts when we do them. So if we're offering a PHTLS class here in Richmond, we are extending that out to the other planning districts. Now, with that said, we do have to have enough people to have the class. So while you might want to have, let's say, some sort of merit badge course and you're in Charlotte County, but you only have 3 people, it's very hard. It's very hard to do that. So one of the things that we requested years ago is that, once you have enough people to have a course that you're requesting and that you can have so many, we'll come and we'll do that. So we'll work with you. If it's something that a provider or an agency is looking for, just contact us and we will do our best to accommodate.
All right, this one comes from Winston Garnett from Louisa Rescue. Does OEMS plan to or foresee a statewide EMS symposium, and if so, when?
So a symposium, as people probably remember it from years past, there's no plans to resume that. It was a very expensive process. It was a very manpower intensive process, and we simply don't have the funds nor the manpower to support that. So in each of the regional council contracts, they're obligated to a multi-day CEU event in each region at least one time per year. So I know that Region 7 just had their regional conference. So there's 7 conferences happening at least one time per year. There's also multiple agencies that are doing regional schools, like Caroline County, I know has a week-long program. The VAFR, as you just mentioned, just heard, has 3 different events, 500 or 700 people events 3 times a year. The VFCA has a conference. So there's a lot of options that have kind of stepped up to fill that void. And we don't have any plans to return to the EMS symposium as it was.
All right, I'll read the next question. From the Tuckahoe Volunteer Rescue Squad, 2 questions. For the Richmond area, can transport be facilitated to cold/hot shelters instead of ERs for homeless individuals? That's part 1 of that 1 question. The answer is the OEMS and the council has no regulation or stipulation that for transports. That's a decision between the medical director and the agency on where you transport patients to. So you can absolutely transport to a hot cold shelter. I mean, you can't bill for it, but there's nothing prohibiting you from doing the transport. Another part of that question is, could an official translator service be provided for all EMS agencies? I mean, from a ADA perspective, that is an agency responsibility. So I'm not sure. I mean, you're required by the ADA to have language services, including sign language, American Sign Language. Otherwise, you're in violation, of their patient rights. So I would encourage agencies to seek out providers. I think it wouldn't be unreasonable if the office gets a list of available providers, but I don't think it's the role of the council to provide a service. All right. Next question is a fantastic one. I love it. Can the wound closure protocol be expanded for advanced EMTs and basic EMTs to allow basic stitches? The answer is the scope of practice could be expanded. That is a request to State Medical Direction Committee. And I would encourage that request go through them and they could discuss it and bring it, and if it's approved, bring it through the process from the Medical Direction Committee to the Governor's Advisory Board, from the Governor's Advisory Board to the Board of Health. So there is a pathway to get that through. So I encourage you to go to the MDC.
I'll take the next question. This is from Caitlin Hughes with Richmond Behavioral Healthcare Authority and Stephen Burry with ESS. Provider mental health, specifically bipolar providers working within EMS and increasing rates of suicide. Are there any more resources for bipolar providers or other EMS providers seeking mental health and well-being support? So I'm not aware of any specific bipolar resources that we have available in the region. But I will tell you that we've said a couple times tonight that there was some special funding that the councils could request. When we submitted our contract for redesignation, we asked for 2 special projects. One was to get our whole blood program kicked up for the region, and the other one was funds for mental health training. And like the whole blood program, we were also successful, and we are also grateful to the Office of EMS for providing funding for some of that training. We thought that it is a priority for the region. We are aware that there have been multiple suicides within our region, and we do share your concern. So we have some exciting things that we're going to share with you very soon. But we're securing right now 2 programs, and you'll see more to come on that. Beyond that, we have a peer support committee that's a standing ODEMSA Region 6 committee, but we are transforming that into a health and wellness committee. So it'll have a more broad mission, and that committee will have some 7 elements to it, where we'll not only focus on mental health, but also provider financial health, physical health, and several other things. So we're excited to bring that to you and probably sometime in the beginning of next year, because we have some other things that us 4 are trying to kick up, but we look forward to sharing some of that with you. In the meantime, the funding that we got from the Office of EMS, you will see that training beginning in August, and you'll see that throughout the rest of this year and into March. We're in discussions and partnering with the Virginia Central Virginia EMS Expo for one of the projects that we want to do. So thank you for that question.
If I may add, there are some resources that OEMS provides, although Heidi, to your point, I'm not sure that they're specific to bipolar. But from the OEMS website, if you click on emergency operations and then provider health and safety, there are some resources there that are available for providers who are experiencing crisis. But we also have a provider health and safety committee that functions at the state level to look at all of the things that go into wellness and protecting our providers. And so I would encourage you to become involved if you're interested. Dr. Bierman-Fote at all of these uses it as an opportunity to recruit people for committees who have passion and interest. And so would certainly encourage you to reach out. That information for the committee liaison is provided on our website, but also you can reach out to Heidi or Ryan, and they can share information. It is a commitment from the Office of EMS and from the public safety community. And we do have some resources that are available. It's why we were very, very happy and excited to be able to support the initiative within the contract that Heidi was talking about that has a meaningful impact in the mental health space for our providers.
And I just want to, and usually when I speak in public, almost every time I do mention this, the region has a regional peer support team that are available for agencies' needs anytime. Our team is very active. I know our coordinator happens to be here tonight, but I know there was one week, I don't even know how they did it. I think they were on a call every night and some during the day. So they're very active and available when you need them.
And then if you're looking for resources within the region, you can visit our website at odemsa.net/help. There's mental health resources there for you, as well as ways to contact the peer support if you need to make an activation as well. I got Jessica. And then you want to do number 2 for the page.
Yeah. So Mr. Dan Hamilton, who happens to be here, submitted a question in advance. Overall VDH reorganization plans regarding EMS councils and healthcare coalitions, consolidation, integration, etc., mass casualty plans, rework, including patient distribution training. I'm just going to add that regarding this, we Region 6 have a very strong connection with our healthcare coalition in this area. In fact, they were in our ploy until just June of last year. They are in the same building with us, just across the hall. So we share a great partnership with them. Dan, I wasn't sure if you had a question in there. And you're welcome to come forward.
Thanks. So maybe it's a question to the broader VDH, how the healthcare coalitions might be integrated, and do you foresee them to integrate further with regional EMS councils? And then to the MCI patient distribution side, do we see any kind of statewide change of plans, more of a statewide patient distribution model versus a regional type setup? Because each region, in terms of the coalition, does it quite differently. So are we looking to bring in a more statewide integrated model? Because any MCI is going to likely cross regions. So thank you very much.
So the Emergency Operations Division is looking at all of those types of topics. I know we're tasked by code to develop and support HBIRT teams. We have a group of individuals looking at, what happens when an EMAC request is received. How do we send and receive resources across state lines? We've had a couple of potential large-scale MCIs even recently, and we're having conversations. What is what is the role, what are the gaps, what are the needs in the community, and how can we fill those? We work very closely with the Office of Emergency Preparedness, as well as VDEM and fire programs. So we have an individual in the Emergency Operations Division that's sort of the liaison and coordinator between all those entities to make sure that we're partnering on projects and working together. So yes, as far as the healthcare coalition piece, I'm not familiar with any upcoming changes. I know there's a portion of the healthcare coalitions that are contracted directly with VDH, and others that are partnered and connected directly with the VHHA. So I have not heard of any plans to update or change that model. Mhm.
We did have something submitted by Dr. Willoughby Hunley. He's the medical director for Boynton Life Station. His statement just is county jurisdiction over independent EMS.
Yeah, I think if I understand his comment correctly, I'll just make a comment on it. So the locality by code has the responsibility to seek to assure the provision of EMS, so they can delegate the provision of EMS to another entity. And if doing so, then that entity is independent of the county. So the county really has no jurisdiction over the entity other than to seek to assure the provision of EMS. I think I got that correct.
Okay, we have someone online.
Yeah, we have one question, and it's from Scott Zelinski. Is there any appetite to host classes such as merit badge, CE, etc., in a round robin fashion of hosting EMS agencies?
Yes, there will be. And again, it's something that Chris, our regional training director, and I've had a conversation about. We will have a schedule of those merit badge courses, and they will be offered in each planning district.
I don't have any further questions from before the meeting or from the Q&A section of the meeting.
Does
Anybody
any-
else here in person have anything?
Okay, well, it seems we have come to the end of our first town hall forum in Region 6. So first, thank you for having us. Thank you for coming. Thank you for participating and engaging with us. And we encourage you to speak to others so that when we have another one, we can get more and more engagement. As we've done these across the Commonwealth, each one we've ended up adding a little bit more because something is coming out, or somebody will ask a question that will make us think, oh, that's important to put out. So I look for these to be a little bit more common for us moving forward, and just thank you all for your support.
Yeah, thank you for engaging in conversations that they're driving toward making improvements in EMS delivery. And for somebody online and for everybody who came here in person and the leadership team from Region 6, we're very grateful to be in partnership with you. And we are here to support you. So I do want to yield to Deputy Director Wayne Perry, and then those of you from ODEMSA, if you have anything else you'd like to say.
No, just to echo those thoughts. I know MK and Greg have put a tremendous amount of work into these town halls and a lot of time driving back and forth. So I appreciate all of that. We're very happy to partner with each of the regions and ODEMSA in particular for Region 6. So thank you for being here. This is not the end. It's not a one and done. There will be more of these depending on the availability of everyone's schedule and the time, but you have contact information for the regional coordinators and obviously for the regions. So please reach out, let us know some feedback, be looking for that EMS needs assessment survey and help us get the word out so we get the best possible information back. We're crafting the future of the EMS system, looking well into the future. So we need good, strong information to make that happen. Thank you.
On behalf of Region 6, I want to thank everyone who joined us tonight. I thought the questions were very good and engaging. And want to thank the Office of EMS for putting this, for having us do this, which is a great thing, I think. As you know, we'll be doing these again in the future. So, we just want to thank you. I think one of the themes that I picked up on tonight is just engagement. There are things that I'm sure that you guys would like to see us do. And, we do have mechanisms for you to engage with us and to engage in committees, engage with our operational medical directors. You have the ability to directly engage with the Office of EMS, or you can engage with us so that we can communicate with them either way. So we welcome that. I think the future is looking good. Again, I said earlier that there was some doubt in the past few years, but that's over now. And this is a new day. And we have new contracts. We're moving forward. And we have new staff on board. So I think that you will soon see some progress and some things that I think that you'll enjoy. Thank you.
That's it.
All right. Thank you.
Thank you.
Until next time.